I understand that desperation. I didn't know what I was. Well, I said I don't know. I didn't know what I was going to do if I didn't get it.
Yeah, what's up?
Because I was units all year.
Oh, that practice stuff. What? Yeah.
Not for credit.
Sorry.
Yeah.
Don't. If you had trouble, you know. Because they're all like a lot younger than you anyways.
Professor, yes, I turned in your course evaluation. Same.
Thank you. Yeah. Thank you guys for doing that, being on top of
If
that.
you don't mind,
What do you mean?
you had a.
Yeah, it was just personal because I woke up this morning and I have this rash. Not so bad right now, I have cream on it, but like it's just like it was super itchy and just bad until I was late trying to like find.
Is it like the bipolar?
I don't know what it is. Something
My boyfriend, he has type 1. I don't know which one you have. I'm not
type 2.
So my boyfriend has the depressive type, and he gets like a really bad like rash.
Yeah, I don't know. And I think I've heard about that, but I've never had it before. I'm assuming it's just some necklace or something that I wore, but it's like, it's a type of itchy where I'm like
If it's
fighting it.
happening when you're more stressed, what really helps him is getting coconut oil, just like putting it on in the big space before he goes to bed. Because he's trans, so he puts it on and then like he has to take his tea. She does the injection, so then it makes him already itchy.
Oh, yeah.
Fucking damn it, I'm itchy.
Yeah.
He's ready for taking injections, man. Those scare me. For him, he's been on it since 16, 20 now. Poor guy, though, his dad takes it. So my poor boyfriend wasn't the dad, but he's has been fucked. Because his dad takes the same, like, prescription testosterone. He's barely had any of that. I think so that were. But you don't just freak me out. For me, they're not gonna bother me. That is one of the other things. This is why I'm not going into nursing. I'm thinking of putting Depo and starting to fill because tired. I love my aunt, but she does it like literally right in the butt, like right in the middle. And I'm like, Aunt Brandy, I mean, that hurts.
You're not? What are you? There's a paramedic out there that has the black silk. Yeah.
He's a man, and you're, and I'm also going to a man. I'm not on T yet due to my whole life. He is, because when my boyfriend got me, so I'm already getting into nursing school.
Cute. I like that a lot.
And I like her mom very much like that stronger than his because I know my spirit and she's old and I drink and then stuff all over I let her
She was born.
So,
Yeah, he's a but he's been on T since 16. His dad's on T. He's a man, but his dad is just low on testosterone. So that's why poor thing. He's been on it for 4 years. The past few years, he hasn't been able to. He's putting everything top surgery. Bottom surgery isn't labeled. Anybody's business will be his. Yeah. That's what that's our, both of our goals. But because of my whole life, I can't at the moment. But that's we're gay. Be gay, keep scrolling. No, I know. That's why I don't want to answer, but there's a meme that says be gay, keep scrolling. It's very funny. Have you seen that one video that's like atomic bomb versus stopping baby? Yeah. AJ gets it. I need, Professor Yost, I need to show you this. This is terrible. But
I know.
I thought about this when we watched the whooping cough video. And I thought of you.
Oh, yeah, there. Literally from that video. All right, guys, we're gonna get going with our Kahoots. Review chapter 20, or chapter. So look, sign in.
I heard that comment anywhere.
All right, let's get going. Make sure you're signed in. And we're gonna get started. Oh, geez. All right, question 1. What is the most common infectious illness in humans?
Acute diarrhea. I'm such an unserious person. I can't take diarrhea seriously.
I don't know. When I've heard about like actual nurses, you'll learn to take it seriously.
Oh, no,
I've heard
yeah.
it gets pretty bad.
But, I also.
All righty, it's gonna be dental caries. Tooth decay is the most common infectious illness in humans. If it's driven by bacteria, it's infectious. Or any other microbe, it's infectious. All right, which diarrhea causing pathogen is associated with cruise ship travel?
You just say that. And so I know what it smells like on an ammonia based level too. So it's like it changes you as a person.
All righty, this one would be norovirus. While rotavirus is like the most common viral cause of diarrhea in people, the one that's associated with cruise ships will be norovirus. Both of them fecal, oral, and foodborne. All right, what is a common bacterial cause of foodborne acute diarrhea?
You can just set this.
So while all of these guys cause diarrhea, the bacterial cause in this list, the only one that's a bacteria is Campylobacter. Giardia and Cryptosporidium are both going to be protozoa, and then rotavirus is a virus. Question 4, choose all that apply. What traits do Shigella and S-Tech share? So this you'll have to go back to the notes for. All righty, so the Shiga toxin produced by Shigella is a toxin that S-Tech E. coli also shares. So that's the Shiga toxin, and the Shiga toxin is what leads to imparting these bacteria their ability to cause dysentery, the bloody diarrhea. Then we have the fact they're both gram negative, a little lesser known fact about them, but they are. So E. coli is modal, but Shigella is non-modal. And so that's a difference there between them. Moving on. True or false? The best treatment for acute diarrhea is fluids and electrolyte replacement. All right, so this one is true. Most diarrhea isn't going to necessarily be treated with antibiotics unless absolutely necessary.
You put acute diarrhea, that's what threw me off.
Why would that matter?
Because I feel like we need something else besides just water.
So there's either acute diarrhea or there is chronic diarrhea. That's the only type. So some of us will be like, oh, whenever you have diarrhea, then normal diarrhea, you would treat it with this, but like acute diarrhea, but there's either acute or chronic. It has to be one or the other. So there's like that too. So anytime you have diarrhea, the best treatment is typically going to be especially acute diarrhea. So if you have chronic diarrhea, we need to treat you. Like you've been having diarrhea for more than 2 weeks straight. You're definitely going to need treatment for that. Now, in the meantime, while we're waiting on that treatment, whatever antibiotic or antiprotozoal or whatever that we're giving you, you will be treating that how? With electrolyte and fluid replacement, yeah? So that's going to be the best treatment always. What type of pathogen causes cholera? Oh, the itchiness of it. I'm like trying really hard not to itch at this. Okay, so this is a bacteria. Cholera is caused by the bacterium Vibrio cholerae. Sorry, I have a rash on my neck and it is like, you know how it is when you have something super itchy? It's just so itchy right now. Okay, what is the proper term for inflammation of the liver?
A medical terminology class. I started that class in this semester online and then dropped it after a week. I got stressed out. It was not easy. It was so much memorization.
All righty, hepatitis. All right, there are vaccines available for all 3 major types of hepatitis virus. Is this true or false? All right, this one's false. Hep C does not have a vaccine. There's only a vaccine for A and B. There is treatment for Hep C, but no vaccine for it. What is the most common helminth infection worldwide? Talked about this in lecture. All righty, this is the giant intestinal roundworm. It's also known as Ascaris lumbricoides. Ascaris lumbricoides. We don't have that in the US, but worldwide, most common. How do schistosomes infect their host? Trying to look up to see if this classroom was free after this, but I can't open the page. So we're just going to move up to the lab when we do the review after this.
Because they use your skin protein stuff.
All right, so this is going to be entry through intact skin and contaminated fresh water. They do have a life cycle step in the snail, and then that's where the infectious version of the schistosomes will come from.
No, not the crack test. I think it's the milk. No, I think this is mainly.
All righty, good job, everybody.
But my mom's also going wild. I just read everything. If it's living in the community, is that safe?
All right, so chapter 24, we're going to be talking about the infectious diseases of the genitourinary system. So to start off with the urinary tract, we have all of your toxins being filtered out of your blood by the kidneys at our top. And so they're going to filter out the toxins from the blood, and then they're going to be released through the ureters, and then that will drain into the bladder where it will be expelled via the urethra. We have the flushing action of the urine that prevents a lot of bacteria from being able to make it up that high in the urinary tract. We also have desquamation of epithelial cells lining the urinary tract, meaning that we're shedding cells that sheds the bacteria that might attach to them. Most bacteria that are adapted to adhere to the cells of the GI tract are not going to have enough adherence to allow them to travel into the urinary tract. There are a few exceptions to that, but there's also the acidic pH of the urine that is going to make it inhospitable, as well as the presence of lysozyme and lactoferrin, and the secretory IgA of our mucosa. We're going to also be going over the reproductive diseases as well. And so understanding the general anatomy of how these organisms are going to get in. We're talking about the male reproductive system. Most of our genitourinary diseases are going to be going in through our urethra and the penis. And we are going to talk a little bit about the difference in the biome of men who are circumcised versus uncircumcised as well. In the female reproductive system, we have ability for infection of the urinary tract through the urethra, but the reproductive tract is also going to be affected by some of our diseases. This would include entry through the vaginal canal and include effects within the uterus as well as the fallopian tubes and the ovaries. In the female reproductive tract, our microbiome will vary over the lifetime of women, and so will the defenses that are going to be apparent. And this is usually due to effect of hormonal changes that we're going through, as well as, you know, whether or not you're sexually active and things like that, exposing you to new biomes. The secreted mucus in the female reproductive tract is pretty helpful in being defensive and microbes being able to get a hold in the reproductive tract of women. We also have the secretory IgA in the mucosa and the low pH of the vagina, and that begins in adolescence. It doesn't start until adolescence. Once we go through puberty, that pH of the entire reproductive tract, but especially in the vagina, is going to be much lower, and that's usually due to certain bacteria that ferment sugars into acids, creating that acidic environment. Lactobacillus bacteria are responsible for that one. The biota of women in childbearing years will be helpful in preventing microbes from harming the fetus whenever a fetus will be growing in the uterus. The normal biota kind of differs between men and women, but not by a whole lot. There's generally speaking going to be very similar biota there. The difference in risk for urinary tract infection is potentially defined by the fact that females have a shorter urethra versus men, and so there's more flushing action going on there. So women are more susceptible to UTIs as a result of that. However, with men, with circumcised versus uncircumcised, the biota of a man who has a foreskin versus the biota of a man who doesn't is different. And so the biota of having a foreskin actually increases the inflammation in the area and can make them more susceptible to getting infections, including STIs. Is that inflammation from it? If they're not circumcised, yes. So the folds of the foreskin can harbor bacteria that can increase inflammation and then make them more susceptible to certain infections. So many of the same residents in the male tract versus the female, especially when we're talking about the external portions of the biota, external portions of the genitalia versus the internal, when talking about the biota there. So this is mostly going to be predominated by lactobacillus and streptococcus. And of course, for men and for women, both the microbiota will shift once sexual activity begins and we become exposed to other people's biomes. Microbes associated with STIs can take up residence in the genital tract, even becoming part of the biota even after treatment in some cases. Men engaging in vaginal, anal, or oral intercourse can harbor bacteria that can produce vaginosis in females, causing a shift in the biome in females during sexual interactions. For females, we used to think that the uterus was sterile, but now we believe that there is biome there that participates in colonizing the babies during birth and things like that. Again, a lot about lactobacillus here, and this is going to shift once we have sexual activity, and even during the menstrual cycle, how that change is going to be happening can shift the biome, as well as going through menopause or pregnancy. Any of these major changes in hormones can cause a shift in the biota. Once a woman becomes menopausal, their biome pretty much stays the same after that. We do have the presence of Candida albicans at low levels. So this is the yeast that we talk about with yeast infections. So it's normal to have this in low levels as part of the biome, but when it overgrows is when it becomes a problem. So let's start talking about urinary tract infections. We have kind of 3 different levels of the urinary tract infections. Urethritis is infection in the urethra, causing the inflammation of the urethra. Cystitis, inflammation of the bladder caused by infection that has moved up into the bladder. This can cause pain in that pubic area as well as difficulty urinating, and then potentially cloudy urine with a bad smell or blood in the urine. And then pyelonephritis is inflammation of the kidneys due to infection, and that pyelo is talking about the production of pus within the kidneys. And so this will be an actual inflammatory and infectious response causing damage to the kidneys potentially if left untreated. All right, let's get into our urinary tract infections. 80% of all urinary tract infections are going to be caused from E. coli from your own body. This is that adherent one, the diffusely adherent E. coli is responsible for this. It is able to adhere stronger than most other GI bacteria because of its fimbriae, and then be resistant to the flushing action of the urine. Catheter-associated UTIs are also usually going to be caused by E. coli, Streptococcus saprophyticus, and Enterococcus species. Again, usually from the GI system of the patient. What else I want to say about this? Best way to prevent these are going to be hygiene practices. So for, I'd say, not hospital-associated catheter infections, but at least with at-home infections, the best way to prevent this is through hygiene practices, so urinating after sexual encounters, as well as wiping from front to back for women and that sort of stuff. Moving on to leptospirosis. This is a zoonotic disease that's associated with animals. This is way more common in animals, and we do have vaccines available for animals for lepto. This is basically going to start out in the blood and the cerebrospinal fluid, and then it moves into the bladder and is transmitted through the urine. In the leptospirosis phase, we have fever, chills, headache, muscle aches, conjunctivitis, and vomiting. So basically being sick, like if you had the flu. But then in the immune phase, when the immune system starts acting up with inflammatory response, you can have development of meningitis, as well as kidney invasion, hepatic disease, jaundice, anemia, and neurological disturbances from that inflammation. So leptospirosis can be a deadly disease, and it can be very difficult to detect or even treat, especially in humans where we don't expect to see it very much. This is much more common in pets. This is caused by a bacteria, Leptospira interrogans. It is a spirochete that has a spiral shape to it, and its little hooks allow it to adhere to the endothelium of the urinary tract. It also is able to invade bloodstream pretty rapidly as a result of being able to move up through the urinary tract and through the kidneys and then into the bloodstream. What else do I say? It is treatable with antibiotics. There's videos on these. I might come back to them if we have time. Vaginitis, this is inflammation of the vagina, so itis, right? This is important to remember our itises because vaginitis versus vaginosis are different things. So vaginitis is inflammation of the vagina. This can be due to a number of things, but in the case of infections, it's usually caused by Candida albicans yeast infections or Trichomonas infections. Yes, question.
The slide that was talking about the yeast formation of the epithelial cells in the urinary tract.
Yes.
Is that just like stating that it's transitional?
Yes. So just like your skin on your body sheds cells just naturally, that's what this is talking about. So just the shedding of the cells just naturally.
The squamish cell.
Yes. So that's like, yes, the surface cells of these guys. Yes.
Okay.
All right. So vaginitis, usually inflammation of the vagina, usually caused by, we're talking about the infectious forms, Candida albicans or Trichomonas. So Candida albicans is a fungus. It is dimorphic, so it will either be budding yeast or it can form these like hyphae sort of structures. We can detect it pretty easily with just a basic swabbing of the vagina and looking at it in a microscope with a gram stain or other kind of simple stain. It is an opportunistic infection. Usually the bacterial biota of the vagina will get shifted somehow, either from activity or because of antibiotic usage. And then the bacterial population drops and then the yeast is able to overgrow. We will treat this with topical or oral azole drugs. Whereas Trichomonas vaginalis is a sexually transmitted infection. This is a protozoa as well. So Trichomonas vaginalis is a protozoa. It's a flagellated protozoa. They do swim around and they're pretty easy to see them in microscopes swimming around. This is the most common non-viral sexually transmitted infection. So we're going to talk about the most common sexually transmitted infection in a little while, and it's a viral one, and it shouldn't be any surprise. I think we talked about it previously, which is going to be HPV, human papillomavirus, is by far the most common sexually transmitted infection. But that's a virus. And so this is the next most common sexually transmitted infection. When you guys start to going around in the ERs and dealing with ER patients, if you do your rounds at the Southwest Integris ER or other more inner city kind of ERs, you're going to see a lot of hookers with this. I mean, a lot. So they're going to test often positive for this. So we treat this with metronidazole. Vaginosis. So this is infection of the vagina without the inflammation side of it. So the inflammation isn't necessarily the thing that's characterizing this. And so a lot of times you can still have inflammation in other parts of the reproductive tract, just not in the vagina. It's not pronounced by inflammation in the vagina. And so this can lead to inflammation in the upper parts, in the uterus and the fallopian tubes and things like that. Vaginosis is primarily caused by overgrowth or infection with other bacteria. And so this is often just a mix or overgrowth of just bacteria that you already have, overgrowing the lactobacilli that maintain the biota. This can lead, if unchecked, to pelvic inflammatory disease and lead to infertility and ectopic pregnancies because of the inflammation that can cause in like the fallopian tubes and things like that. The eggs can't move or implant like they're supposed to anymore. It isn't sexually transmitted. It's not necessarily associated with sexual activity, but it is more common in sexually active women. Again, usually just due to the shift in the biome. Moving on to prostatitis. This is whenever we have inflammation of the prostate gland associated this time with bacteria. And it's usually the same bacteria that cause UTIs, but they are able to move into the prostate instead of just staying local to the urinary tract. There are acute and chronic versions. Acute versions is usually, again, normal biota from the GI tract. This is more common in men that have unprotected anal sex that aren't urinating after. Similar sort of signs and symptoms to what we see with bladder infections, frequent urge to urinate, difficulty urinating, blood in the urine, and also painful ejaculation due to the inflammation of the prostate, which provides the fluid for that. All right, moving on to gonorrhea. In males, they have urethritis, painful urination, yellowish discharge, but many cases in males are asymptomatic. So men can actually carry this without symptoms pretty frequently. And then females will have mucopurulent or bloody vaginal discharge and painful urination as a result. They can also develop salpingitis, which is inflammation of the fallopian tubes, as well as pelvic inflammatory diseases. A lot of times when we're talking about these sexually transmitted infections, again, not inflammation of the vagina, but inflammation of pretty much everywhere else in the female reproductive tract. And that this inflammation in fallopian tubes prevents the eggs from being able to pass the way that they're supposed to through the fallopian tubes and down into the uterus where they're implant. And so they get stuck in the fallopian tubes, and that can lead to ectopic pregnancy. The children that are born to people that have the gonococcus can also have eye infections leading to blindness. And again, showing you the female reproductive tract and that fallopian tube, that if there's inflammation in the fallopian tube, the fertilized egg will stay caught in the fallopian tube and won't be able to move into the uterus to implant properly. And that's what we call an ectopic pregnancy or tubal pregnancy. This is a baby that has ophthalmic gonococcal infection from being born to somebody that had gonorrhea. Gonorrhea is caused by the gonococcus or Neisseria gonorrhoeae. So Neisseria meningititis was the meningococcus, and this is the gonococcus. So these guys are related, and they do look similar under gram stain. This is a pyogenic gram-negative diplococcus, going to cause inflammation in the upper part of the female reproductive tract. Has phase variation, meaning that it's able to change its antigens on its surface to evade the immune system. It's transmitted through sexual contact. Infection with gonorrhea is going to increase your likelihood of getting HIV if you do have sexual interaction with somebody that has HIV due to the inflammation in the reproductive tract, causing the virus, the HIV virus, to be more likely to cause infection as a result. Chlamydia often comes along with gonorrhea, although you can have one or the other, they often come hand in hand. So chlamydia is basically caused, we've already learned about the bacteria, it's Chlamydia trachomatis, also associated with trachoma when it gets in the eye. In females, these females in this one is going to be the asymptomatic. So in gonorrhea, males tend to be asymptomatic. In chlamydia, females tend to be asymptomatic. again, we'll have some discharge and pain associated with this. In females, they'll have inflammation of the cervix and discharge, as well as inflammatory disease of like the pelvic
And they call it
organs.
the drip, right?
Do they?
I think so, like way back in the day.
I don't know. I'm not up on that. So we call gonorrhea.
Did not need that visual.
Gonorrhea is the clap. Yeah, gonorrhea is the clap.
Soldiers are crazy, and that's probably where.
Yeah.
But, you know, because if you go to like Korea or stuff like that, like there's mandatory.
Mhm.
Come back. Yeah, but I think like street name.
That makes sense. Yeah. So this can also lead to lymphogranuloma venereum, where we have the invasion of the lymphatic tissues as a result of having the sexually transmitted disease. And this can lead to pretty widespread signs and symptoms as a result of that. Again, chlamydia trachomatis is the bacteria that causes this. It's able to prevent the phagosome and lysosome from fusing, and therefore is able to survive phagocytosis as a result of that. It's gram negative, it's found worldwide, and we do treat this with antibiotics, but co-infection with gonorrhea is common. The issue with gonorrhea is going to be that more and more we're seeing more antibiotic resistant cases of gonorrhea, and now it's gotten to strains that are completely resistant to any antibiotic treatment. So that's going to be the issue with gonorrhea. With chlamydia, we can still treat it with some stuff. And again, we'll come back to the videos after we've gone through the lecture portion, if we have time. All right, syphilis is the next one. This is, again, something that's pretty much existed for a while since pretty much people have been having sex. Syphilis has existed. It's considered an old world disease, but it is basically reappearing in the new world, we say, in the modern times. There is a study that I wanted to talk to you guys about from history, which was called the Tuskegee Study of Untreated Syphilis in the Negro Male.
Oh, I've
And
seen
yes,
one,
this
yeah.
is
Awesome.
this is where they would have Black men who couldn't read or write or anything like that come and sign up for a study, being told that they were going to be treated for their syphilis, but they would just monitor them over time and just deliberately not treat them, even though treatments were available. And this started in 32 and then continued into the 70s. Yeah, it's the 70s. Yeah.
People forget how not
So-
gone
Yeah, no,
racism
it's
is.
one of those like big psychology studies that like that the prison experiment said you can never do these things again.
Yeah. Yeah. It's basically like these people came and signed up to get treated, but all the paperwork said, we're not going to treat you. We're going to see what happens to you because we're not treating you. So we can investigate the
But
effects.
they were illiterate.
They were also going to have as much pay as they were promised, all
Yeah,
that good
yeah.
stuff.
Yep, they weren't paid well for it at all, if at all. And yeah, it's a big issue, very questionable sort of behavior, extremely questionable. Let's not forget how terrible people can be. All right, let's move on to the stages of syphilis. There are 3 stages of syphilis: primary, secondary, and tertiary. There is a latent phase also if you are one of the people that does get into latency. So primary syphilis is defined by the chancre. And that's how you pronounce this. It's not, what do people call it? Canker? It's not canker. This is a different thing.
Not a
Yes.
canker sore.
Yeah, it's not a canker sore, okay? This is what they call chancre. This is a small red hard bump that appears at the site of entry. It is usually painless for some people anyways. I don't know how, because when you see the pictures of it, it doesn't make any sense to me. But this is defined by the initial entry site of the bacteria into the genital, oral, or anal cavities. However it gets into the body, it leaves that small red hard bump at first, and that's what defines primary syphilis. Secondary syphilis, is this even picking up sound? Because it's not even like showing it on here. I hope it is. Anyways, secondary syphilis, this will be defined by the progression of this disease to be a little bit more systemic. Fever, headache, even sore throat associated with this, as well as lymphadenopathy. But the biggest, so primary syphilis is indicated by that chancre sore. Then the secondary syphilis is defined by the rash. And so it's a brownish rash, a red-brown rash on all skin surfaces, but particularly on the soles of the feet and the palms of the hand. And it can be associated with hair loss. And then we have latent phase or tertiary syphilis. They're just not the same thing. You might go latent and not have signs or symptoms, but if you develop into tertiary syphilis, this is now going to have systemic damage quite evident throughout the tissues. And so they have these gummas that develop. These are like tumor-like growths that are going to be developing on the body. This is where you start seeing those very disfiguring sort of masses on people's faces and things like that, or lesions that develop in the tissue as a result of the spread of these bacteria throughout the tissues of the body. And then eventually it will spread into the nervous system and lead to dementia and even coma and death, but neurological symptoms. I don't know, probably a
Good
lot.
amount, yeah, good amount.
Probably all.
Yeah, it depends. I don't know. I don't know the exact numbers for it. That's a good question. All right, moving on to congenital syphilis. This is whenever you're born to a mother that has syphilis and then birth canal, you're exposed to it. This would be usually through the eyes or the mouth. This can, if you have syphilis as a mother, just due to it being in the system, this can lead to fetal abnormalities just during the development, but can also lead to spread to the infant through the eyes and mouth later through the birth canal. All right, so here are some images of the different stages of these. Yes, question. 128 people died from it.
How many were experimented on?
In the study.
Yeah.
Yeah, in the study. Yeah, in the
only
study.
74 people stayed alive.
Oh, cool.
Like 75%.
Wow. Yeah, that's like, I don't know. People are horrible.
Die, you know, you can help them.
People are horrible. All right, so right, and there was definitely treatment available at the time, just to be clear. All right, so this is image A, an image of that chancre sore. Image B, we have the rash associated with secondary syphilis. And image C, this is the gumma that has developed on the face of this man, where you can start seeing the lesions and tumor-like effect of the bacteria. This is caused by the bacteria Treponema pallidum. It is a coiled bacteria that its little hooked tip allows it to attach to the endothelium. It has certain proteins that are associated with its ability to help it infect the host. Every time that you have unprotected sex with somebody that has syphilis, there's a 12 to 30% chance of contracting it per sexual encounter. The best way of preventing the spread of syphilis is going to be prevention through condoms, barrier protection. Again, this is completely treatable with antibiotics. So here are some more images of syphilis. I also have another video that we can come back to. This is an image of a gumma. And so these lesions that are on the faces of these people and on this man's scalp here, these are the gummas. So these tumor-like lesions, they can also grow to be big, like an actual tumor. But these lesions that are associated with this is the gummas associated with that. It's not uncommon to see them developing on the face and the head.
And I wonder how many people think, oh, I just have cancer.
Right. All right, moving on to chancroid. Again, another one associated with a chancre sore. This is caused by bacteria Haemophilus ducreyi, which is a gram-negative rod. This one's not spiral shaped. And so this forms a soft chancre, whereas in syphilis, it was that hard, small chancre that was painless. In this case, with chancroid, it is painful in men and often unnoticed in women. I don't know how, because if you see pictures of women that have this, it looks horrible. But apparently, whatever, if it goes unnoticed, I guess people aren't checking down there. It's I don't know, I'm going to judge them a little bit for that. But common in the tropics and the subtropics, again, sexually transmitted, usually associated with sex workers and poor hygiene. Uncircumcised men are more commonly infected with chancroid because of already having the inflammatory response associated with their biome due to not having foreskin or having the foreskin, trapping that biome in there. This is treated with antibiotics as well. Moving on to genital herpes. This is either caused by HSV1 or 2. And so we think of the oral herpes being more HSV1 and the genital version being HSV2, but it's not clear defined that way. You can have either one causing either version as well. So we have several vesicles on the genital area, the perineum, the thigh, and the buttocks that are associated with where we have contact initially with the virus. And then they will form these fluid-filled vesicles that are extremely painful to the touch. And we'll usually have periods of latency and periods of flare-up whenever the virus moves out of where it's hiding out in the nervous system. It can lead to encephalitis. And if the herpes virus is spread to the baby via birth, is whenever we will have neonatal herpes simplex. Again, infections in the mouth, skin, and eyes are going to have a 30% mortality rate, whereas once that infection spreads to the central nervous system, we're looking at an 80%, 50 to 80% mortality rate, which this is not considered an appropriate risk in the medical community. Yes.
So, like, my grandma used to tell me, like, once you get a cold sore, like, you're like, you know, you're gonna get them easily again. So, like, you know, I've had a cold sore. Does that mean I have?
You have HSV1. Almost everybody does though.
Okay, okay, I was like, well,
So don't let anybody, don't get it twisted, folks. If you had a cold sore, which almost everybody has had one,
yeah.
you have herpes.
Well, look, the one-
Okay, it's forever.
My
Yes.
mom never let her.
It doesn't go away. Now, you might not always have a cold sore, but it's just hiding out in your nerves. And then if you get stressed out, then you can have cold sores.
Like everybody has their biota, or how do you?
We don't consider it part of a biota. We consider it still an infection.
So I'm saying, I
Yeah.
don't ever remember having like any type of cold.
If
sore.
you've never had cold sores, you might not have it. Yeah.
But my son, like 6 or 7, like,
You do know you get them from drinking after people.
Drinking after people. Yeah, and so this is the thing with herpes is that it's still easily spread sometimes. Okay. We say when you don't have an outbreak of herpes, you're not contagious. That's not true. There's still a low level chance of it being able to be spread even when we don't have outbreaks. Did you have a question, Gavin?
Right? When they, oh, you had a fever sore.
Yeah, that's usually herpes. Yeah.
Yeah.
Yes.
So my grandmother gave one to my brother, when he was a baby, who was just born. She, kissed him, does that mean that he was a chance to be 30%?
Yeah. Yes.
Yeah.
My grandma was crazy, she didn't listen to me.
Yes. So this is the thing too, like if you have a newborn baby, don't let people kiss it. Don't let people kiss your newborn babies.
Oh, yeah, no.
Because I've already heard some pretty gnarly misinformation. You can get cold sores from drinking after people, kissing people, like mouth contact with anybody. If you have cold sores, don't let people drink after you. Don't be a dick.
Yeah, don't be a dick.
Don't be a dick.
Don't be a dick.
So most commonly cold sores that we think of as just being cold sores, especially if they come up whenever you're stressed, or if you're sick with something else because your body's stressed, not immune response, then that is usually caused by HSV1, typically, herpes simplex virus 1, and that is herpes virus. And that is the herpes simplex 1 is the one that we talked about causing, like, being the most common cause, basically, of encephalitis overall. We talked about the arbovirus as being associated with that. When we think of herpes, we don't attribute it to encephalitis. We attribute it to herpes, cold sores, or genital herpes. But the number one cause of encephalitis actually is HSV1. Sorry, you had a question back here, and then I'll get AJ.
I was just curious, so like, you know how you get like bumps on your tongue, like a mouth sore, canker sores, what we call them?
Sometimes can be associated with HSV1, but sometimes other viruses too. So that one's a harder one to say. 'Cause it can be a lot of other things. Jack?
Okay, so like,
You still.
it's obviously an STD, but what else would it be? Because as a sexually transmitted, but it could also just be transmitted from like drinking.
Oral, yeah, oral. Yeah, so do we say it's sexually transmitted? Primarily, HSV2 is the one that we consider to be more sexually transmitted, whereas HSV1 we'll just say is oral. Yeah.
So if you have it in your system, not an active flare up, could sexual contact transmit it?
Yes,
So if you've had cold sores before, don't have them actively, you can still. get them.
potentially, yes. Now, the likelihood is very low. Like, we talk about like the statistics of you spreading it on.
0.00.
I don't know the exact number, but it's pretty low when you don't have an outbreak going on, but you can still transmit it without the outbreak. Gavin had a question. I'll get Haley.
Lower those chances on top of.
Yes. So Valtrex is commonly used to decrease the ability of the virus. Once it's starting to come out of the tissues, it inhibits it from multiplying there. But once it's hidden in the nervous system, it means there forever once it's in the nervous system. Yeah. So we can't cure it, but it keeps the outbreaks from happening and has the incidence of it being spread significantly decreased. Haley, did you have a question?
So like for children, so like I've had a cold sore, right?
Mhm.
So does that mean like my daughters would be like more susceptible? Like I haven't had like a cold sore forever, but does that mean like they could possibly have like?
They might have it already because you had it, but they might not either.
Right.
So yeah, I don't know what the likelihood of it is, but yeah, I haven't had a cold sore in forever either. So I don't know like what the likelihood is of me spreading it around to anybody. Yes.
They get on the corner of your mouth.
Yes. Yeah, in the corner. So if you get that thing in the corner of your mouth where you get that like kind of breaking of the skin. And so if it looks like sort of like a pimple, so these are vesicle forming. So if you have vesicles associated with it, like that, so it'll be raised like vesicles, fluid-filled vesicles, then yes, that's probably related to herpes. And there's a rupture and then leave like the typical like cold sore, what we usually think of. But if you get like that thing in your side of your mouth where it has like those like cracks looking thing, that's called cheilitis. And so that can be caused by a number of things. It might be herpes, but it also can be due to a lot of things. Like there's a lot of things. Stress can.
My son a couple weeks ago had like a little pimple looking thing right here, and it finally like just popped and just went away,
Mhm.
and I didn't know.
Yeah, and that's what herpes will do too. So, I mean, if that is what it is, I mean, what are you gonna do about it, right? Yeah, yeah.
So I worked at a pharmacy, we're like type of orders, but we did long-term care, so nursing home stuff. So we get one order for the medication and then here comes 4 more orders. So, you know, we're like, who's patient 0?
Yeah, who's spreading around the herpes, yeah.
It does happen, but and not just to young people.
Oh, nursing homes for sure.
Yeah, yeah.
Nursing homes.
Let the old people just.
There's always outbreaks in
So
nursing
now we're
homes.
trying to figure out who patient 1 was.
So we know about herpes it's caused by a DNA virus that's able to incorporate itself into your cell. It is going to hide out in your nervous system and then reactivate from stress, UV radiation, injury, just shifts in our hormones like due to menstruation and other microbial infections that cause stress on the immune system. You do have to have exposure to the secretions containing the virus, but like I said, there's still a very low chance that you can spread it even whenever there's not an outbreak going on. Acyclovir is our drug of choice for this, and Valtrex is a version of that. It doesn't cure, but it does prevent the lesions from showing up. Okay, I was supposed to put a video here and I didn't. Cool. All right, so to go over our diseases, we have this lesion over here on the far left. This is the chancre of the primary syphilis. Here we have chancroid, which is caused by Haemophilus ducreyi. This is the chancre associated, the soft chancre associated with that. And then over here on the far right, we have images of the vesicles that are associated with herpes virus. This time on the penis, but it could be anywhere in the genital or buttock region. When we look at the prevalence in the United States, 25% of adults do have HSV2, which is our sexually transmitted version. All right, moving on to the human papillomaviruses. The human papillomaviruses we visited in our skin infection. These are the causative agents of warts in general, but now we're talking about the STI versions. This is the cause of genital warts, as well as when we start talking about some of the cancers associated with this. So signs and symptoms of having an HPV infection. There might be growths on the genital area for men or female, as well as silent infections in the cervix. So women can actually have the genital wart producing versions of HPV associated with the cervix and not having a presentation of the warts, and then can transmit it to men who can then have the wart presentation. And then warts can appear associated with the sexually transmitted version of this anywhere on the genital area and the buttocks. And if it becomes very large wart-like growths, we call that condyloma acuminata. This is a branching cauliflower-like masses associated with genital warts. HPV is also associated with cervical cancer. So the strains of HPV that are associated with cervical cancer do not cause warts. And so if you are having HPV infection, then you can have these versions of HPV and not have any signs or symptoms. Men won't have signs or symptoms and women won't have signs or symptoms. Women are tested pretty regularly by going to get your pap smears done. Highly recommend that you get pap smears done because it's the #1 way to catch cervical cancer before it gets to the point where it's untreatable. And it has significantly decreased the incidence of cervical cancer in the United States, but still 4,000 women die each year from cervical cancer caused by HPV. Cervical cancer is caused by HPV.
So I know there's like hundreds of strains of HPV. So a pap smear test for the one that's specific.
There are several of them that cause cervical cancer. So there's like 10 of them that can cause cervical cancer.
But it's only gonna be HPV.
But it's only HPVs, yes. And so like they can do basically PCR to just look for the presence of HPV like DNA, and they can narrow it down to the strain that you're gonna have. But typically like when they do a pap smear, they're testing for that as well, especially if you're still sexually active. They're not just going to be looking at your cells for abnormalities, but also testing for HPV at the same time. It's usually part of that now. Males can get genitourinary tract cancer from HPV infections as well. It's not just women that get cervical cancer, but can get cancer of the penis, of the anus, and all sorts of other areas as well. Again, these are DNA viruses that incorporate themselves into your DNA. HPV 16 and 18 are the ones that are most commonly associated with the cancer development, but other ones are associated with it as well. 25 to 46% of women under 25 already have HPV. Let me say that again. 25 to 46% of women under 25, this includes age 0 to 25, will already have HPV. Once you are a sexually active adult, 90% of people have had HPV at some point, but 25 to 46% of women under 25 are going to get HPV. Now, the reason I'm talking about it this way is specifically because we're going to, introduce this idea of preventing this through the vaccine. The vaccines exist, Gardasil vaccine exists to prevent infection with HPV. So if you say to yourself, oh, my daughter isn't getting that because my daughter isn't going to have sex until marriage. 25 to 46% of people under 25.
So you're gonna be a young grandparent, I'm just saying.
Right. So, good luck with that. So they did start recommending Gardasil to, especially to women age 13 and older. And now it is still available to adults and men up to the age of 26. You can still get it as an adult if you request it from your doctor, but your insurance won't necessarily pay for it. But it can prevent the spread of these cancer-causing viruses, and they are effective. And if you're under this disillusionment of your child isn't going to be sexually active, or they're definitely going to tell you when they need these things or something like that, just think back to whenever you were 13, 14, 15, 16. Tell me that you were being good that whole time. So don't trust your kids for that. And getting these vaccines can prevent them from cancer, y'all.
How often do you need to be getting that?
I don't know the frequency of this. It's one of those ones that I think you get it once. I don't know if there's even a booster. I think it might just be one vaccine shot. And it prevents from 9 different versions of it, including some of the genital wart causing ones. All right, next is molluscum contagiosum, wart-like growths, but they are not true warts that are associated with sexual transmission. This is really not going to be serious unless you're immunocompromised. So here's some pictures. This is that cauliflower-like growth associated with the genital warts. And then over here we have the molluscum contagiosum.
I think you know if you have any of this.
Yeah. All right, next we have group B strep. This is a neonatal disease that women, about 10 to 40% of women are colonized with group B strep. This is Streptococcus agalactiae typically, but it can be other group B strep as well. So these are beta hemolytic strep that basically inoculates the infants on the way out, and then the infants can become infected from these bacteria that are just naturally present in the vaginal canal. It can cause bloodstream infections, meningitis, and pneumonia in these babies, and it can cause, if these babies get these infections, can cause permanent damage. I had a student last semester who her baby was born, and then she didn't test positive in the strep test, but she had it, and her baby became infected, got meningitis, and had permanent hearing loss as a result of that, and ended up dying later on in life because of complications caused from this. So this is not something to be taken lightly. So we screen women at 35 to 37 weeks for this. So if you are giving, premature birth, then, your risk for this is going to be higher if we haven't tested for this yet during. So, yeah, but it is treatable. This is just showing some of the prevalence and incidence of these. So we see that herpes and human papillomavirus are super, super high of people that have had or have tested for it. Most people aren't getting tested for HPV. So let's be clear about this. Most people aren't going to have signs or symptoms associated with it and won't have the need to get tested. And like how many women are getting their pap smears regularly, and they may have cleared the virus without knowing that they were transmitting it to somebody. Or men almost never know that they have it. There's no signs or symptoms in men. And so we're not testing men for it. And so they could just be spreading it around. All right, let's go over questions really quick. What is the most common cause of UTIs? E. coli. What type of organism is Trichomonas vaginalis? Protozoa. Excellent. What pathogen causes syphilis? Okay, what type is it, first of all?
Gram-negative viral bacteria.
Treponema pallidum. What disease is caused by Haemophilus ducreyi? Chancroid. And what pathogen is associated with cervical cancer? HPV. All right, so let's come back to some of these videos because you gotta love it, right? So let's get at it. Don't you love it? So let's see. All right, lepto. I don't feel like lepto gets enough exposure, so I'm gonna play the video for lepto for this really quick. Again, a zoonotic disease.
When I started drinking warm water to help
I
me lose
bet.
weight, my
I
friends
bet.
laughed at me. But when they saw how fast I was changing. they
Man,
started
that
to
warm
focus
water
on
will do it, guys.
Yeah.
That must be what's
which
missing.
causes significant kidney issues and significant liver issues. Hi guys, my name is Dave, I'm a veterinarian, and today I'm gonna talk about the bacteria leptospirosis, also called lepto. And what vaccine we use to help prevent it. If a dog does get it, how do we treat it and what do we see? And most importantly, how is the dog going to do after eating lepto? Leptospirosis is a bacteria, it's a spirochete, and there's actually a handful of different serovars or variations in the lepto disease. So one dog could get lepto, and another dog could get lepto, and there could be different species of lepto. Leptospirosis is usually transmitted by other dogs or from wildlife via urine or their secretions. So I'm sure a lot of you have been to the veterinarian and they pull out this vaccine called leptospirosis, or it's in combination with your distemper parvo vaccine. Like any vaccine, it's not perfect, but the vaccine has been shown to be helpful in preventing the disease. Like any vaccine, you can get vaccine reactions. So that may include vomiting, diarrhea, hives, and the really bad cases, severe anaphylactic reaction, which would include a very lethargic doggy that needs to be seen with a veterinarian. Leptospirosis is one of the diseases where we don't see a whole bunch. And I as a veterinarian here in Nebraska, I see it just a few times a year. But the problem with that is leptospirosis is a horrible disease which causes significant kidney issues and significant liver issues. And if got untreated, and even with treatment, some of them die from it. Some of them develop chronic kidney disease, and it can be incredibly taxing and entolling and life-threatening for the doggy. What does a pet owner notice when the dog has lepto? Lepto usually causes symptoms like lethargy, don't want to eat, or anorexia. They may vomit. The big thing is you may not see the really significant signs until later, because lepto will cause liver and kidney damage. And as the disease progresses, the doggy may get like an orange or jaundiced skin. But at first, if it's noticed right away, you may not see the actual problem. You may just see the tip of the iceberg, and under it, blood work wise, we have a major issue. When a client goes in the veterinary office, we'll do blood work and we'll do urine. And what we're going to see is increased kidney values and increased liver values. Now, a lot of things can cause these values to increase. But if you give me a healthy dog who's like middle age and there's no other pre-existing conditions, and magically we're sick, I'm thinking because it's infectious. So based on our history, if we hadn't been vaccinated for lepto, we're going to do a lepto test. And sometimes you can do lepto tests in-house. Other times it can be sent out to get it done. And there's different tests you can do looking for antigens, antibodies, PCRs. But no matter what, we need to diagnose it as lepto. That way we can be confident of what's causing the major organ disease. Once we get it diagnosed, and even without the diagnosis, as we're working on the diagnosis, we're going to get the doggy hydrated with fluids, IV fluids. We're going to hospitalize. We're going to be giving antibiotics to kill the bacteria. We're going to be doing a handful of things, all hands on board, to hopefully help this doggy to feel better. Most dogs with lepto stay in the hospital for a few days. They are zoonotic. People can get this disease too, and so can dogs. So we need to handle this doggy very carefully with gloves and masks and the whole 9 yards to make sure nobody else gets sick. In some cases, the dogs will completely recover and do well. In other cases, we may have chronic long-term kidney issues. And unfortunately, in some cases, some of them do pass away because it is a really, really horrible disease. If you have had any experience with lepto, please go ahead and share and like and provide comments. I really appreciate it when people share their experiences, because that's when we all can grow and learn more.
Best and worst dinner for
Oh,
your
right.
race. Sweet potatoes. Try to find the perfect.
All right. So we definitely want to watch videos about these sexually transmitted diseases, right? Let's see what we can find. The gonorrhea and chlamydia. Let's do this one. We have a couple videos. Yes, yes.
What?
Untreated chlamydia or gonorrhea. Now, this scar tissue that you're seeing that has formed inside the abdomen are known as abdominal adhesions, and you're going to see some more here. Now, this is usually due to long-term or chronic inflammation, and it's called Fitz-Hugh-Curtis syndrome. What you're seeing here is a potential complication of untreated chlamydia or gonorrhea. Now, this scar tissue that you're seeing that has formed inside the abdomen are known as abdominal adhesions, and you're going to see some more here. Now, this is usually due to long-term or chronic inflammation, and it's called Fitz-Hugh-Curtis syndrome.
All right, so there's that to show you some effects of that.
Those are numerous positive aspects of sexual contact. There are also some possible consequences, including sexually transmitted infections. This is the first video in a series about sexually transmitted infections, and will cover gonorrhea and chlamydia. Hey everyone, my name is Dr. Graham Durtna. Welcome to Bite Size Medicine, your go-to channel for short, easy to understand videos about the common medical topics that matter to you. If you're new, make sure to subscribe, get involved in the comments, and check out the description below for links and resources. Let's get started. Sexually transmitted infections, or STIs, sometimes called STDs for sexually transmitted diseases, are very common. According to the CDC.
So just to be clear, you guys understand the difference between an STI and an STD?
Yes.
Why they changed the language? Maybe you guys, some of you guys might not be old enough to know they changed the language, but it used to just be STDs. Now they're STIs. So this is an important distinction here. When you have disease, you have actual deviation from health, but you can have the infections without symptoms. So you still have the STI. And so that's why they turned to drawing awareness to the STI versus just the STD, because you might not have disease, but you still have the infection and you still need to be aware of that. And this is why testing is so important for awareness of the spread and existence of these disease in many of our communities, especially in communities that may not as be widely using protection, barrier protection, condoms and things like that, or have, you know, regular testing. If you get a new sexual partner, highly encourage that you both get tested, just out of good faith. Even if you and your partner are both like, oh, you're the only partner that I've ever had, still feel like getting tested just to be sure is always a better thing to be aware of rather than find out later on.
So if it's an STI versus an STD, it's based on if it's symptomatic or not?
Yes, yes.
Okay.
So if you have disease once you have the symptoms. And so many people can have things like chlamydia or gonorrhea without signs or symptoms, and we have to be aware of that. All right, so I'm gonna go ahead and just finish playing this video.
In 2018, 1 in every 5 people in the US had an STI. Of the 26 million new infections during that year, almost half of them were in people between the ages of 15 and 24. There are several STIs, and it is possible to have multiple at once, but STIs are preventable, treatable, and in most cases curable. The videos in this series will follow a similar structure by answering the same questions for each infection. This video covers gonorrhea and chlamydia together because it is very common to be infected with both at the same time, and they present in very similar ways. The infection that we call gonorrhea is caused by a bacteria named Neisseria gonorrhea, and the infection we call chlamydia is caused by a bacteria named Chlamydia trachomatis. Both are transmitted by sexual contact and can infect the eyes, mouth and throat, genitals, and rectum. They can also be transmitted to a baby during delivery. The only way to guarantee that you won't be infected is with abstinence, meaning not engaging in sexual activity. But if you choose to be sexually active, then you can do these 3 things to reduce your risk. The first is to have an open and honest conversation with your partners and discuss whether they have an STI and get tested before engaging in the sexual activity. The second is when you are engaging in the sexual activity, use protection, such as male or female condoms or dental dams. Other birth control methods do not protect against STIs because you're still having direct contact without a barrier. The third way is to enter an exclusive relationship with your partner, meaning you only engage in sexual activity with each other, after everyone has been tested and confirmed to not have any STI. If neither you nor your partners have an STI, you can't magically get one. It is always transmitted from one person to another. Common symptoms for both include a cloudy discharge from the urethra, which is the tube that urine comes out of, the vagina or the rectum, and the color may range between white, yellow, and green. Redness and swelling of the urethra, painful urination or bowel movements, and frequent urination. For anyone with vagina, cervix, and uterus, the infections can cause pain during sexual activity, inflammation of the cervix, and bleeding after sexual activity and between periods. There are several complications if these infections are not treated. For anyone with testicles or a prostate, these can become infected, inflamed, and painful. For anyone with a uterus, fallopian tubes, or ovaries, it can spread to them and cause abscesses, which is like a space filled with pus and the bacteria. Or lead to pelvic inflammatory disease, which can cause chronic pain and possible infertility. Chlamydia is actually the leading cause of infertility because it can cause scarring of the fallopian tubes. They can even spread throughout one's body. For example, both can spread to the area surrounding the liver, and gonorrhea can spread to the heart and joints. If the infections have not spread, then there are a couple options, but the most common treatment for gonorrhea is a single injection of the medication in your arm, and for chlamydia, a single pill. If they have spread, then the treatment options are different, and you may have to go to the hospital to receive a longer course of treatment. Yes, you can be reinfected an unlimited number of times because our body is not able to kill these infections by itself. They're not like some other diseases or infections where we kill it and our immune system remembers for next time. In fact, chlamydia is the most commonly reported bacterial STI. A final, very important fact to know is that most people with chlamydia or gonorrhea are asymptomatic, which means they don't have any of the symptoms mentioned above. But they can still get the long-term complications and transmit the infection to other people. So get tested, and if needed, treated. Ask your partners to do the same, and then get tested again to confirm that your treatment worked. Before you go, make sure to like, subscribe, and leave.
All right.
The like and subscribe.
No. All right, and then we'll do this, I didn't put a herpes one, that would have been one to watch, but we'll put this syphilis video real quick, and then we'll be done. We'll start with our review for the lab, or not for lab.
Folks, the day we've been waiting on has finally come. National Concealed Carry Reciprocity is here, meaning that if you
Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. These are result infectious diseases. Specialists at Mayo Clinic says syphilis affects men and women and can present in various stages.
Primary syphilis causes an ulcer, and this sometimes isn't noticed because it's painless and can be inside the vagina or on the cervix. After a few weeks to months, they can get secondary syphilis, which is a rash.
It may then progress to latent stage syphilis, and finally, the most serious stage, tertiary. Pregnant women are not immune to syphilis. Congenital syphilis can lead to miscarriage, stillbirth, or infant death. That's why all pregnant women should be screened. Syphilis is preventable and treatable. As for prevention, Dr. Rizzo recommends barrier protection during sex.
And that's during oral sex, anal sex, vaginal sex, using condoms, dental dams, and any other barrier protection.
For the Mayo Clinic Network,
All right. So that's it for the videos. We're gonna change gears and start our review for the thing. I'm gonna check and see if the classroom is open, because I'd rather just stay here than have to go to the stinky lab.
These chairs are better.
The chair,
Yours are so much
coffee.
better.
OSU, okay, c.edu. No, that's not, I don't know what I was typing up here.
Yeah, I don't know what that is.
Okay. It's not letting me log in. What am I doing wrong? I don't know. It's not letting me look at it. Let's just go up to the lab. So we'll go up to the lab. If you're staying for the review, we'll go up to the lab for the review. I'm just going to review some of the major topics today. And I'll go up there, and anybody that meets me up there will pretty much start at probably 11:20. If you want to take a break, go to the bathroom, whatever you do, 11:20, we'll start in the microbiology lab with our review.